Hello, everyone. Good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adesuwa Usa Uwagye. Today, we want to talk about one thing that affects male and, of course, the female too, because somehow, it will affect the female when it comes to the field of play. If you know, you know. We want to look at the reasons why a lot of young men these days are into aphrodisiac and local okay, let's call it herbal drink to enhance performance as a result of erectile dysfunction. Yes, a lot of that is what a lot of young men are suffering from now. And because some of them see it as a thing of shame, how can it be said that a young man like me at my age cannot really hold an erection for a long time? You know, that kind of a thing. And this is what is forcing a lot of them into some kind of methods of helping themselves that they are not supposed to, that is even damaging them the more. So today we have brought in a doctor to come and talk about erectile dysfunction. If that is what you're suffering from, there's no shame about it. Just stay glued to your television set and watch what we are going to talk about today. If you have a friend who has a friend who has a friend like that, you know, that long chain of my friend, yeah, you can sit back, relax, and enjoy what we're going to present to you today. Pick a thing or two, utilize it for your own good. Join me as I make welcome Dr. Jolly Nosa Igoma, CMD Jonas Medical Center here in Benin City. Dr. Jolly, it's a pleasure to have you join us today on the program.
Good afternoon.
And you look sharp, as usual.
Good afternoon.
All right, you can tune in live on Go TV, channel 140, Star Times, channel 130, UHF, channel 22, Benin, UHF, channel 42, Abuja. You can also watch us online at www.itvradio.com/live. Okay, and you can share your thoughts by posting your comments on all our social media platforms, Facebook, Twitter, IG, YouTube, and TikTok at ITV Radio NG. So if you can't get us to talk to, you can just drop your message, drop your comments. We'll get to it, and we will, of course, get back to you. All right, so Dr. Jolly, let's go into the business of today. When we say erectile dysfunction, what are we talking about?
Yes. Erectile dysfunction is actually a disorder that affects the male. But on the other hand, it will not call for concern following the fact that the woman as a partner not feeling satisfied, we have to bring up a matter. The man will not see it as a problem. By definition, we say erectile dysfunction is inability to achieve erection or sustain it long enough for a satisfactory coitus. Another name for erectile dysfunction is called impotency.
Is it the same thing as erectile malfunction?
Yes.
Okay.
Before this time, we used to understand that erectile dysfunction was a problem of the elderly. Generally, men that are 80 years, statistics has it that 70% will become impotent. But because of other factors that we are going to look at, that is ravaging among youth, among youngsters, erectile dysfunction are cut across both the old and the young. Sex acts as a catalyst that form and maintain intimate relationship. A man and a woman that are married, other than procreation, sex, of course, acts as a catalyst. It acts to consummate marriage. It brings about, happy or cemented relationship at home. In medical statistics, we have it at inability to procreate after 1 year, what we call infertility, can be a problem of the man, can be a problem of the woman, can be a problem of both of them. For example, a man that suffers infertility will not be able to copulate with the woman or copulate with the wife. Thereby, they can suffer what we call the infertility. That is why we say that infertility is 30% caused by the man. Infertility is 30% caused by the woman. Infertility is 30% caused by both of them, while 10% is unknown. But however, we live in a society whereby when the man is unable to pregnate the woman, we believe that the woman is the fault. So we cannot actually, talking about what erectile dysfunction is capable of causing to the family, other than inability to procreate or causing matrimonial discord at home. There are other, problems that erectile dysfunction can cause.
Okay, somebody out there may want to know the cause or causes of erectile dysfunction.
Yes, erectile dysfunction, according to William Masters and Virginia Johnson's that carried out research on this erectile problem, they found out that having loss of erection, it means that there is a problem with, in the phase of the sexual cycle. There are 5 phases of the sexual cycle.
Okay.
There's a stage of desire. There's a stage of arousal or excitement. There's a stage of plateau. There's an orgasm. There's a resolution. The first one, which is the desire, is just like having a fantasy towards the opposite sex. Your body, you can begin to feel some chemistry, some body changes. Whereas in the second stage, which is the stage of arousal or excitement, when there is a touch in the sensitive organ, maybe like the penile, the genital area, so they're supposed to be, like in male, they're supposed to be a tumescence. What I mean is, there's supposed to be an increase in blood flow to the genital area of the male that will not result to rigidity. But when this is not possible, maybe the man is unable to achieve this erection that is capable of, having an intercourse with the wife, it therefore means that there is a problem. Quite a number of causes have been attributed to be responsible for this erectile dysfunction. We look at it as physical cause or organic cause, then we have psychological cause.
Okay.
The physical cause or the organic cause includes the vascular problems. For example, somebody that has arteriosclerosis, maybe there is no proper blood flow. Okay. As I said earlier on, for somebody to have a good tumescence, for somebody to have a good penile rigidity that is capable of, copulating with the partner or the wife, there must be a proper blood flow to the penile area. Okay. But if there is any blockage or there's an improper blood flow to that area, maybe as a result of Peyronie disease or any blood disorder, as the case may be, the person can suffer erectile dysfunction. Not only that, there are some infectious diseases that somebody would have acquired in the past that will make the person not to be able to achieve good erection. It could be elephantiasis. It could be mump that affects children, the jaw swelling. So not only
that can really affect.
It can result in erectile dysfunction in the male, as a complication that will come up.
That is if not well treated.
If not well treated at that stage in life. Not only that, people that have cardiac disease or heart-related disease, whether it's chemical disease, heart failure, as the case may be, can come down with erectile dysfunction. Okay. Not only that, even some urogenital causes, as in the case of a kidney renal, chronic renal failure, so a person that has a varicose, hydrocy, these are disease conditions that we identify that may result to erectile dysfunction. And not only that, some persons that has or that develop neurological disease. Okay. For example, people that suffer brain problem, as in the case of temporal lobe epilepsy, or that has amyotrophic lateral sclerosis, people that suffer transverse myelitis or spinal cord injury, as the case may be, such person also fall into this category to suffer this erectile dysfunction. Not only that, there are also some hormonal causes or metabolic causes. For example, the commonest cause of erectile dysfunction in our environment is diabetes. diabetes, when the man is diabetic, after a period of time when the diabetes is not well controlled, just a period of 5 to 10 years, the person develop erectile dysfunction. So drugs that we take iatrogenically can cause erectile dysfunction. You might be taking a drug for the treatment of one disease or one problem, then the side effects will not result to erectile dysfunction. For example, somebody that is hypertensive, those who take a calcium channel blocker, like amlodipine, ifedipine, I'm not supposed to be mentioning anything. Not only that, drugs that are also water depleting, antihypertensive drug that tend to reduce water volume, which is a way of, those drugs can as well cause erectile dysfunction. And people who have ulcer, there's what we call H2 receptor antagonists. Those drugs can also result to ulcer, like metidine and the like. Okay. So drugs that you take, even some drugs that you take for the treatment of depression, for antipsychotic medication, those drugs may result to erectile dysfunction.
Okay.
Not only that, as I said earlier on, psychological causes. This is a very common cause of erectile dysfunction. Psychological causes as well. Yeah, exactly. Yeah, financial. We cannot actually rule out financial cause from psychological. When you have money, you're always happy. You feel, that sense of belonging will be there, but not in most cases. After all, we have also seen some very rich persons whose wife goes to be doing those things, following the fact that the husband or the sexual partner has erectile dysfunction or not able to carry out, the sexual function, as the case may be. It could just be the organic type. It could just be the physical cause, not actually psychological. So what I'm trying to say is that having money will not actually say you will not develop erectile dysfunction. Stress, anxiety, depression, difficult life situation, all these can result to erectile dysfunction. So in considering erectile dysfunction, we would like to know whether it's a lifelong thing. It means that from childhood to adulthood, this person has never gained an erection. It means it's a lifelong problem, and that would be very difficult to treat. Such person has never gained an erection. Having an erection in early hour.
Is it possible for someone to be born with that problem?
Exactly. Like as I said earlier on, somebody that has this brain congenital problem, anything that is capable, because for one to have a good erection, there's a psychic contribution. The brain, there are, neurotransmitters. There's a nitric oxide synthase, which is a vasodilator, which, activates the cyclic adenosine monophosphate that will cause, the blood flow to go to the penile region that cause that tumescence. So if this higher center is lost, maybe as a result of injury, it could be a birth injury to the brain, like amyotrophic lateral sclerosis or other condition that is capable of affecting the brain, or that is even capable of affecting the perineal region. What I mean, the genital area. Maybe there is a improper blood flow to that area. Maybe as a result of malformation during baby formation in utero. That could be the reason why this person has never achieved erection from childhood to adulthood. That's what we call the lifelong problem. It could also be acquired.
Okay, doctor, we'll take a very short break now. When we'll come back, we'll come and talk about what is happening to today's average young man who is finding it so difficult and relying on aphrodisiac and all the herbal medications, particularly this one that they talk about, these Agbo people. You see them taking it and then you hear them say, this one a manpower, this one a voting, this one a booster. When we come back, we'll ask Doctor all of those questions. Do stay tuned. All right, thank you for staying tuned. You can join us on www.itvradioNG.com.live. And you can share your thoughts with us, your comments and all of that. If you join our social media platforms, FB, Twitter, IG, YouTube, and TikTok, if only you will log on to at ITV Radio NG. Do all of that and you'll be part of us. All right, doctor, there's this new trend now. Gone are those days when you say that, okay, erectile dysfunction is commonly old age problem. But nowadays you find young men indulging in all sorts of herbal drink just to get, you will hear them talk about it. I need to take this one, I get work, oh, you know, that kind of a thing. Work day, my baby's coming. This is the only thing that can help. If not, nothing. What is this new trend all about, doctor? Why are young men coming down with erectile dysfunction?
Yes. Erectile dysfunction is not very common in youngsters, following the fact that many drugs are not available for abuse. Use of psychotropic drugs, you know, drugs that tend to enhance sexual desire. I will tell you that it's a two thing. When I spoke about the sexual cycle, I said desire, arousal. The drugs that you take that will make you to be aroused might not make you to have, the drug that you take that will make you to have sexual desire might not cause you to be aroused. So it's a two different things. So what am I trying to say? People that take psychoactive substance, maybe tramadol, like morphine, like codeine, like barbiturate, like chacasolic acid diethylamide, like codeine,
just
and the like.
Continue with the talk.
You know, even cannabis.
Let's leave the name of the drugs aside.
So those people that take those kind of drugs, it's after taking those drugs, they have this sexual urge and feeling, that fantasy. But on the other hand, those drugs tend to depress the sexual arousal. It's just like alcohol.
So what's the need of taking the drugs?
Yes,
then?
it's just like alcohol. People who take alcohol, it makes them to have, it makes them to feel, to have, you know, they feel high. They feel high, yes. That might make them to have that sexual urge. But on the other hand, when they're in the act, they will not be able to perform because of the effect of the alcohol. So it's a two-way thing. So because of this exposure to those medications, because of this internet stuff, people take those drugs to high. Indirectly, they are killing
themselves.
Their sexual. And I will tell you that aphrodisiac drug is the most common drug of abuse after analgesics. Aphrodisiac, that is drug that you will take to make you achieve good erection. Because those drugs do not even have a control. They might not even need to see a qualified person to get those drugs.
Okay, doctor, what's the cure for erectile dysfunction?
Yes. The cure for erectile dysfunction is to know the cause of this erectile dysfunction.
Okay.
This is, you know, let's delineate it. I said that erectile dysfunction could be psychological, it could also be physical, organic. If you are not expressing early morning erection, it means that your erectile dysfunction is caused by organic or physical cause.
Oh, so there must be an erection in the morning.
Yes, to an extent.
Okay.
You have found out that over time, like for a very long time, you have never experienced early morning erection. You belong to the category we classify as organic or physical cause, not as a result of anxiety.
Does that have a cure?
Yes. So those ones have given either heart problem, liver problem, kidney problem, neurologic problem, you know, and the like, hormonal, maybe testosterone insufficiency, we might not attribute it to be a cause. Okay. Not psychological, not depression, not anxiety, not worry condition as the case may be. But if you express early morning erection, maybe you undergo what we call self-stimulation.
Okay,
as a way of reducing
this morning, early morning erection, does it have to do with age?
From the age of 40, it might reduce. But once in a while, you might still experience early morning erection. It might not be frequent as below 40.
Okay.
You know, as I said earlier on, that some persons, it's a lifelong thing. Erectile dysfunction, they have never experienced erection. That might be very difficult to tackle. But whereas some persons is acquired, maybe because of the disease condition they have acquired over time, that might be the reason why they will not be able to achieve erection. Knowing the cause, of course, will enable us know how to treat it. Okay. Not only that, for example, somebody that is hypertensive, and you are taking a particular drug that might be responsible for the erectile dysfunction, giving an alternative medication will help to control the erectile dysfunction. Okay. Not only that, somebody that is diabetic, your sugar level is not well controlled. Maybe the diabetes is not causing what we call a neuropathic disorder, a neuropathic problem that is capable of affecting one's nerve sensation. That might be the reason why there is loss of erection. So, giving the right medication, controlling the sugar, you are already treating the erectile dysfunction. Not only that, if it's a psychological cause, that is when we adopt what we call the non-pharmacological method, or what we call the psychotherapy method.
Okay, how is that one like?
For example, the sexual partner have to be brought into the picture. I will tell you that most people that suffer erectile dysfunction, and don't forget that erectile dysfunction is a problem of the man, but for the fact that
it also affects the woman somehow. It's the man and woman's problem, exactly. I tell you.
For the fact that the man is not able to perform well, there is bound to be matrimonial discord.
Exactly.
There's bound to be quarrel in the house, no matter how rich the man is. It's better said. You see, in our society, in African society, people like overlook polygamy, but polyandry is a thing that we detest in entirety. So that is to say that if the man is not doing well sexually, there must be a problem in the house, as the case may be. So in that case, the woman have to be brought into the picture. There's what we call the stop and start, which is a form of a couple, which is a form of a dual sex therapy. Okay. Or it can be analytical.
What do you call it again?
Start. And
I want my viewers to hear that.
Start, stop. There's a way.
Stop,
yes,
okay.
there's a way. There's
like
a way.
Starting and stopping.
Starting and stopping. There's a way the woman can be stimulating the sexual organ of the man for this erection to be sustainable. It's possible that during foreplay there is an erection, but during the course of penetration, the erection disappears like the tortoise head in the shell. So in that case, there are things that the woman can do that will help to sustain this erection that will be long enough for a satisfactory coitus.
Okay, doctor, we're going to pick it up from here next week because time is fast spent. We'll pick it up from here next week, definitely. And then we'll take some calls next week. For those of you who may want to ask doctor some questions, we're giving you like a very long period of time to think about the question you want to ask only on erectile dysfunction. We'll come here next week, Monday, take it from this point, and then ask for your questions, all right? That means you'll be given a chance to call in so that doctor can respond to all of your questions. This is the point where I say thank you, Dr. Jolly,
it's a pleasure,
for finding time to join us on this program.
Thank you.
And please, it's a very serious issue. No shame put, all right? Just call in next week. 2:30 will be on the show by the grace of God, and then we'll try our best possible to help you with the problem that you're going through, all right? A problem shared is a problem solved, and thankfully, Dr. Jolly is that man you will want to talk to. Thank you, doctor. We'll see you again next week. Keep it with us. Bye-bye.